Now scanning the right lower abdomen to rule out cause of pain and tenderness. Here we see the gut loops containing gases and free fluid around the gut loops in the right lower abdomen. The gut loops appears to be normal and shows normal peristalsis. Here we see the cecum. The walls of cecum are inflamed and the submucosal layer, which is echogenic, also prominent and thickened. Here we see a ring-like structure. Now rotating the probe at its axis, it becomes a lumen which contains fluid and debris. It could be an appendix. Here we see an echogenic material in the lumen, and from here the appendix is arising from the cecum. It is appendiculate. The free fluid or collection is also present at the peripendicular area. The surrounding tissues of appendix are also inflamed and echogenic. Now we will measure the diameter of appendix. The anterior posterior diameter of appendix is 10.6 mm, but the normal diameter is up to 6 mm. Now how we will write report.